Hi, I'm Jenny. This video is probably a little bit overdue. If you're searching for this video about scapholunate surgery repair, you might have seen some of my older videos from 2 years ago today. I think I made my first video like the day before I was going to have the surgery, and I went into the whole history of how I pole dance and how the injury was pretty terrifying and very painful, and I made the decision to get surgery. And so that was August 13th, 2019. A lot has happened since then. A lot has happened in the world and it's still going on since then. But to just bring it down to anybody who's having similar pain in their wrist and this surgery, I want to just add my name to the list of success stories. So let's start off with maybe some of the more challenging things. I still don't have 100% flexibility in this wrist. If I want to, I really have to work at it. I still get very stiff from the scar tissue. I still battle that every day. I had a great post-op physical therapist who really worked with me quite a bit. And I want to say about sometime 9 months ago, I was still noticing that I still get really super stiff. So I started going to local physical therapy once or twice a week, and that's helped a lot. So I'm back on the pole. I'm doing everything. When the pandemic hit, we had to get a pole for the room. Of course, I'm not going to do it now because I'm just coming back from 2 hours at the studio. But I will interject some videos to show. So pause, insert video. I did this today. This is my favorite move. I remember going into pre-op when they were giving me the sedatives. I remember falling asleep dreaming of this move, and I woke up thinking of this move. And then I finally got it about a year after my surgery. So in 2020, once we had the pole installed and we were all getting back up and running, I started training that, and then I've been doing that move solidly since last September. So very happy about that. So some of the things that help with stiffness with physical therapy, I got this from Amazon. This helps a lot. It's one of those gripper, I think they call it a net. That's what it is. A big gripper net. That helps a lot. Also, this TheraBand really helps. You could get it on Amazon. TheraBand. They have me do this at the physical therapy center as well. That keeps my wrist active. I always feel great after I start climbing that pole a little bit. Then I tend to loosen up. Also, this massaging wand from Renfro. I think it's on Amazon for I think it's on sale for 30 bucks. I think I paid 40 last year at some point. And it helps just, you know, when I'm done poling, I just kind of run it over my hands a little bit, get it loose, feel better. And because my original post-op physical therapist told me that I should start tossing a ball up in the air, I think I tried to do this in one of my last Scapholunate videos on YouTube, and I wasn't very good, but look what's happened. Hey! So, there we go. Look what you could do when you get surgery and you've got a really good doctor. So this is very relaxing. It's a lot of zen. It helps loosen up my wrist after I've been poling for a while, or when I've been working at the computer. It gets very stiff from working that mouse. So, I mean, juggling's not for everybody, but you could try. One thing, if you decide to start juggling, you will spend half the time chasing the balls around the room for about the first 6 weeks. But then, you know, after a while it clicks in. So I've been juggling since about Christmas Day 2019. So I wouldn't want to get this injury ever I could have lived my entire life without hearing the word scapholunate, let alone have to doctor shop and learn about the surgery and what it entails. But I will say this, because I got the surgery and tore my scapholunate and had to do something to get my wrist loose, I taught myself how to juggle. So there's the one good thing that came out of the injury, is now I can juggle. And I probably wouldn't before, because I wouldn't have thought of it, or it wouldn't have occurred to me. But yeah, I'll cut in a couple more pull videos of what I did today. Probably showing a ballerina or a jade or whatever, but this is all fun stuff. I love it. I can do my really hard tricks now, like my elbow grip hold underneath, you know, with when I hand down. But my wrist is doing great. It's doing well. It's stiff. I won't lie. I'll never be able to do a handstand again, and I can't quite get 90 degrees on either side. But I don't know. I never really liked doing handstands anyway. And I could do headstands, or I could do an iguana. That's a way to get on the pole like a headstand, but with your hands on the pole. You know, there's a lot of things you could do. I went and saw my doctor, and she just said, you're never going to do push-ups, planks, or handstands, so let it go. Fine. And, but I showed her all my pole videos, and she was like, yep, you've got the strength. Keep going. Keep doing what you're doing. And good luck. If you're considering getting this surgery, I got really lucky. If you watched any of my other videos, they did not take a tendon graft from me. They used something called a MyTech swivel lock. They repaired me with something that's in there, and it's going to stay in there. And so my recovery was a lot faster. I never went into a cast. Very aggressive physical therapy from the very first week. And so there you have it. And I mean, my nemesis is a cold, rainy, overcast day. I could feel that. My wrist will tell me, oh my God, it's going to rain. And so I just know that I need to just do some extra physical therapy, go take a bath with Epsom salts, and just, you know, push my hand down and try to make 90 degrees in warm water. And, you know, it will never be the way it was before the injury, but that's okay. It's better, and I can do everything I want to do. So, you know, it's just good luck. And if you have any questions, I always respond when people message me here. So good luck. Get the surgery if you need to. I hope you can. All right. Take care.